back pain prescription drugs and medications. Hi, I'm Dr. Peters with Peters Wellness Chiropractic Massage, and last week I did a video talking about the safety of chiropractic and the risks that are involved in, well, pretty much anything you're going to do is going to have risk involved, right? I mean, if you're out walking the dog, I've had so many patients come in where they're walking their dog saw a cat, jolted out on them, and has injured their shoulder and strained their neck. Just from a simple, I got a chocolate lab, he's 80 pounds. If he pulls fast, that's going to pull and jerk and injure something, especially if I'm not prepared for it, right? So the idea that there's risk involved in everything, but some things are much riskier than others. And remember, doctor means teacher. So my job, my goal is to educate you and help you make those types of decisions with more knowledge available to you. So one of the main drugs that are prescribed for low back pain or pain in general can be opioid drugs, right? We talked about NSAIDs and things like that. Well, this week, talking more about opioids and the risks involved. So keep in mind that, I've got my handout here for this week, that opioids are actually a powerful narcotic. So we're not talking about just your over-the-counter type medication here when we talk about opioids. And for some of us, you might say, well, I would never take something like that. Well, if you've never been in extreme pain, it might be easy to say that. But if you have been in a lot of pain and the doctor says, hey, I'm going to give you something that's going to make you feel better to get through this, I think most of us would be like, I'm in, man. Tell me what I need. And when you hear this, so some of the common brands, I've got them listed here, OxyContin, Percocet, and Vicodin. So, and trust me, I am not here to judge. About, 23, 24 years ago, I was mountain biking in Northern California, coming down this peak called Mission Peak. And to make it more challenging, we went at night, and the night we picked happened to be very foggy. So I've got all kinds of excuses of why I crashed. We were coming down on a different trail than I thought we were on, and with the fog, it was hard to tell. I tried to clear a ravine. I didn't quite make it. My front tire caught the other side. I flipped over, landed on my head and my shoulder, and I was in excruciating pain. I didn't know at the time what I had done, but I had separated my shoulder. And if you've ever separated a shoulder, it's quite painful, especially when you still got a couple of miles of downhill to do at night on a mountain bike. So I went to the hospital. They gave me, Percocet was the one they gave me. I took it. And I'm sure when they gave it to me, they told me all the warnings, over the counter and let me know. But I was in a lot of pain, right? So I took it. And, looking back, I probably didn't need it. Maybe I was being kind of a wimp. But I took it. And thank God my wife was there to care for me because apparently I was a little bit loopy. But I'll tell you what, I made it through the night. And I've never taken Percocet or anything like that since then because it did make me pretty loopy. So, but I'm not here to judge and say, oh, you should never do that. If you're in a lot of pain and you're suffering and you're going to do something to get you through so that you can find something that will work more long term, do what you need to do to get through. So I'm not judging and I'm not telling you what you should or shouldn't do, not that it would matter, but looking for alternatives, right? Chiropractic is an alternative to drugs and medication, and sometimes it can be done in unison until the problem is resolved. And sometimes people need surgery. I had someone 2 weeks ago, she's like, well, I don't want surgery. I'm like, I'm looking at your MRI and I can see the report. I think you might want to have a conversation with the surgeon, right? Sometimes these things are necessary, even though people don't want to do them. So I wanted to reference a couple things out of this week's handout. So according to a report by the Centers for Disease Control and Prevention, or the CDC, one person dies every 19 minutes from an unintentional drug overdose. One person every 19 minutes from an unintentional drug overdose. If chiropractic was killing one person every 19 minutes unintentionally, I guarantee you I wouldn't be talking to you as a chiropractor right now. So we're looking for things that are safe and things that are effective. Since 2003, more overdose deaths have involved opioid pain-killing medication than heroin and cocaine combined. Let me read that again. Since 2003, more overdose deaths have involved opioid pain medication or opioid pain-killing medication than heroin and cocaine combined. So we are talking about a serious issue here. And I know there are things being done to reduce this. We're getting more and more referrals from the Veterans Administration for patients coming in and helping them to get relief without some of these, strong side effect drugs that are out there. And speaking of side effects, listen to this. So you're taking something to make you feel better, but listen, I believe I have 10 of them listed here. So opioids may also confer a multitude of potential side effects, the most common of which are constipation, nausea, vomiting, dizziness, sedation, difficulty breathing, and addiction or drug abuse. In addition, opioid use is linked with gastrointestinal problems, liver disease, muscular rigidity, and hormonal disturbances. Those are just the side effects of taking them. So obviously, if you need to take something like this, don't stay on it very long. You do not want to be doing these things long term. And there's a bunch of other stuff on here. They pull some information out of Morbidity and Mortality Weekly Report, the Journal of Addictive Disease. There's a couple of things in here taken out of there. So make sure you see this week's handout. But I just want to finish up the idea, my book, right? Pain is fantastic. Who would say that, right? Well, being in pain is not fantastic, but pain in itself is, because it tells us something is wrong. And I just want to read here, painkillers, including opioids, merely mask the pain. They fail to address the underlying root cause. In turn, the true source may proliferate because it is covered up by painkillers. The real cause remains unchecked. The end result is often the development of a more difficult to treat and more painful condition down the road. If there's a problem, get to the root cause of it. Don't just cover it up and cover it up. You know what they call it? It's the pink elephant in the room, right? Let's address the real issue. So if you're having pain, there are so many options. Instead of going directly to medications, think of it, and I've listed a few. Chiropractic, of course, that's what I'm going to say. I'm a chiropractor. Chiropractic, acupuncture, naturopathic medicine, physical therapy, right? Now, I don't do acupuncture here. I'm not a naturopath, but I know one I can refer you to. I know a few of them. Physical therapy, we've got Spooner Physical Therapy right outside in our parking lot or right across the way, and they can help people feel so much better. And then at home, think about it. If you're having a lot of pain, what about yoga? Have you tried yoga? Have you worked with a personal trainer at your gym? You're looking at these different levels. Have you worked with a personal trainer to help get yourself moving and getting things going better? Have you been foam rolling? Have you been stretching? There's so much that we can do. Go to my website, peterswellness.com. I've got 4 foam roller videos on there. I've got people from different countries watching my shoulder foam roller video because it is so effective. And it is, $25 for a foam roller? And so much of what people come in that ails them, a foam roller can help with a lot of that. Now, there are people with, unilateral, bilateral sciatica shooting down into their feet. They probably need something more than a foam roller, and they probably can't even get on a foam roller. I've had people come in who couldn't even lay on my table. I literally have adjusted people up against the wall and strictly using only instrumentation, which is not my favorite thing to do because there's so much more we can do, but to get them through that initial phase to where you can be more aggressive with their care. So if you have any questions, please check out this week's Optimal Health University. It'll be on the blog post. It'll be on Twitter. It'll be on Instagram. It'll be on Facebook. And if you have questions, email me. It's drpeters@peterswellness.com, or just respond on below for the link, and I can get back to people here. But arm yourself with knowledge, because if you have enough knowledge, it will keep you from making mistakes that could have detrimental effects. And as we go through every day, think of the things, the little habits that you can do to make your life better that don't require a lot of time. Foam rolling, 8 to 10 minutes a day, right? Getting the right amount of sleep for your body, right? I talk about these things in my book. If you haven't gotten a copy of it, pick it up. I always tell people there's at least $200,000 worth of information that I've poured into this book. And what is it? It's $9.99 is the cost of the book, or you can get it on Kindle for like $3.99. I think it's on Amazon. But Check it out. Arm yourself with knowledge. Watch more YouTube videos. Make sure you're learning from people that are educated in ways that they can help you be better. Look at where they're at and make sure that they are a good example to follow. So have a great week, and we will see you next week.